Hello, everyone, and welcome to the physical therapy program today. It's a great pleasure for me to introduce today's presenter, Dr. Gregory Ford. Dr. Ford received his doctorate degree of philosophy from the State University of New York at Buffalo and his doctorate degree of physical therapy from the Daemen College. Dr. Ford is served on the Commission on Accreditation in Physical Therapy Education and also is the chair of the PT department and the director of DPT program at Daemen College. Now please join me in welcoming Dr. Ford. Dr. Ford.
Thank you, Mrs. Liu, very much for that kind introduction. I'm really excited to be here to talk about the profession of physical therapy. You're here to learn about the profession more than you're here to learn about me, but just a little bit additional background. I've been a licensed practicing physical therapist for 26 years, and I have no conflicts of interest in this presentation, but my disclaimer will be that I'm presenting this PowerPoint. Most of these slides, the vast majority of these slides come from our open house presentation that we do for the college. My intention is to teach you about the profession of physical therapy and not, sell our program necessarily. So that's my disclaimer, up front. My area of interest and passion in physical therapy is in orthopedics or musculoskeletal physical therapy. And as I hope you'll learn through this presentation, there's lots of areas that as physical therapists we can treat and impact patients on as it pertains to health, wellness, and function. And I want to start with that key word. So, if you take anything away from this presentation about physical therapy, if you came into it really not knowing anything about physical therapy, I would say this. Physical therapist's job is to enhance, restore, or promote function. It's all about function, function, function. So in example, it really doesn't matter at the end of the day if you help somebody's range of motion of their shoulder, get 7, 8, 10 more degrees. It doesn't matter if you've enhanced the strength of their leg muscles, by certain grades of manual muscle testing that you would learn as a physical therapist. Those things really don't matter at the end of the day unless you've done something to promote, enhance, or restore function. So again, we're all about function as physical therapists. I have got a series of slides here that I'll present to educate you about the profession. And this first series of photos that come up essentially speak to, who we treat, where we can work as physical therapists. So this image here, presumably is a physical therapist working with a patient, maybe post-operatively in a hospital setting. This could be an acute care, subacute care, rehab setting. Perhaps this individual has had, knee replacement, so they've gone to subacute rehab. And the physical therapist is working with this individual, again, function-wise, aiding them in using a walker to ambulate. The water, aquatic therapy is an area that physical therapists work in. What a great place to treat patients. And we use the water for lots of things. We could use the warmth of the water to relax muscles. We could use the water for buoyancy to unload joints for somebody that has an arthritic hip or an arthritic knee. Children with a cerebral palsy or spinal cord related injury that has muscle spasticity or what's referred to as high tone of muscles. You could use the warmth of the water to reduce the tone and the spasticity in muscle. So lots of applications for use of aquatic therapy. The pediatric setting, as physical therapists, we can work in school systems, and we do. And so here's a young lady, presumably with cerebral palsy, and she's using what's referred to as a reverse or a ring walker to get her around school. And so physical therapists are in the school system working with pediatrics. If I go back quickly to the first picture of this individual, which appears to be in the geriatric population, I will point out that physical therapists treat the lifespan. So isn't that nice? You could work with individuals that need or would benefit from physical therapy services as pediatric patients, neonates, infants, all the way through the lifespan to the most aged adult and anywhere in between. Here is a young man, and if you read his shirt, Marine for Sale here, you can see that he's in the military. And unfortunately, he's lost both lower extremities. So he's had bilateral lower extremity amputations. Physical therapists could work with that population, or anybody for that matter that's had an amputation. So back to, again, restoring function. We can work closely with the prosthetist, the orthotist, to aid in prescribing and developing the use of prosthetic devices, and then again, getting individuals up for functioning. He's standing in what's referred to as parallel bars right now to work on, learning how to walk once again. This picture here, this gentleman on the table could presumably have had maybe knee surgery. You can see the brace on the knee. So this could be an orthopedic or musculoskeletal related injury, maybe an ACL reconstruction, anterior cruciate ligament of the knee, or patellar tendon rupture, or something like that. So sports medicine, orthopedics is an area that we work in as physical therapists. And as I introduced myself, that's an area of interest and passion of mine. Here's another young lady from the pediatric population standpoint, negotiating stairs. So again, we're promoting function for somebody that needs to climb stairs. Here again is a step-up opportunity on this, this Reebok step aerobic step, another lower extremity amputation, physical therapist working in that area. Sports medicine, orthopedic related, stretching of hamstrings in this example. Now this one's interesting too. If you look at that image, you might want to test yourself as to what's that contraption? What do you think that's all about? The technology has advanced so much in the realm of medicine in general, but we reap the rewards as physical therapists for things that we can do for our patients. So this is a demonstration of a simulation of somebody that may have had spinal cord related injury. So you can see that this gentleman is harnessed up on this treadmill, and there's a computer set up here and so forth. So the unfortunate thing, depending on the level of injury of spinal cord injury, this individual may never walk again. However, there's great benefit from equipment like this to promote muscle strength, maintain muscle size, maintain good blood circulation in the lower extremity, maintain bone density of the lower extremity bones. Lots of good things. Get off the skin, prevent skin breakdown. So the way this computer system would work is there's electrodes affixed to the muscles of the lower extremity. And so when turned on and applied appropriately, this individual literally is walking on the treadmill with support. Unfortunately, current date would say that when they come off of the machine, they're not able, there's no transfer of function to normal ambulation without the equipment, but nevertheless, there's lots of benefits to that. So patients with spinal cord related injury, physical therapists work with a lot. And then this image up here I put up, you might say, well, this one's out of place. Why is there a dog in a pool here? Well, physical therapists can do animal rehabilitation. As a physical therapist, you do not learn how to treat animals in an entry-level physical therapy program. However, post-graduation, there are special interest groups which you could join and be a part of and do animal rehabilitation. You could treat dogs, you could treat horses, you could treat lots of different animals similar to humans, again, promoting function and good quality of life for our animal friends. This next series of photos will get into some of the tools that we use, or modalities as it's referred to augment patient care. So the first here, and if any of you listening to this have gone to physical therapy, hopefully it's not for something too serious, maybe an orthopedic related sports injury, this might look familiar to you. So physical therapists use a lot of exercise equipment. We actually are referred to through our training as exercise specialists. We do a lot of instruction and learning of how to promote health and wellness of patients through exercise. So here you can see a gentleman on a bike. We can use treadmills, we can use elliptical trainers, on and on it goes, the type of equipment we could use for therapeutic exercise. Now, you look at this image, and if you know anything about healthcare and the different fields, you might look at this and say, well, here's another picture out of place. Isn't that not a PT, but a chiropractor? This individual here looks like they're about to perform a thrust manipulation to the spine, where chiropractors do manipulation, but guess what? So too do physical therapists. and it is an entry-level skill. So when you graduate from an accredited physical therapy program, you would learn how to do, when appropriate, when needed, manipulation of the spine and the extremities. Could be the shoulder, it could be the elbow, the wrist, the knee, the hip, the ankle. So that's just another tool in our toolbox when needed for patients that might benefit from a manipulation. Back to aquatic therapy, once again, there's lots of things we can use. We could use weights in the water to add resistance. We can use buoyancy devices to unload, again, those arthritic joints. So lots of things we can do in that area. This gentleman here presumably has suffered a stroke, and you can see the physical therapist is again aiding in functional ambulation. We work to prescribe assistive devices for individuals. It could be a cane. In this case, this is referred to as a quad cane, which you can see the 4-pronged cane makes it a quad cane. It could be a walker, it could be a rolling walker. There's all different assistive devices that may be deemed appropriate for a given patient. That assistive device could be to promote balance and prevention of falls for somebody. It could also be to, again, to unload a painful limb due to an ankle sprain or, again, an arthritic joint or something of that nature. Another walker here in the peds environment. This is a ring walker that this young lady is in for pediatrics. This image here, it might be confusing as you initially look at it. It looks like this person is just lying down and sleeping, and perhaps they have fallen asleep, but this is what's referred to as lumbar traction. So one of the modalities that we use, the therapeutic interventions could be in the form of traction. This happens to be lumbar or low back traction. It could be for the cervical spine or the neck as well. But the separation, the subtle separation, the decompression of a disc in your spine, the decompression of a nerve root that's giving tingling and numbness down your leg or your arm. If you've ever hit your funny bone, you know it hurts. There's nothing funny about it, right? So those type of sensations due to a disc herniation or something like that could be improved upon through our means of intervention, in this case, traction. We also use ultrasound. So over here, this is what's referred to as an ultrasound wand or ultrasound unit. You might hear and think of ultrasound as a way to do imaging, right? So, to determine the health of a baby, to determine the sex of a baby, we'll use ultrasound for that, or, gynecologists, will do that. Obstetricians will do that. We use ultrasound, a different form of ultrasound, as a deep heating agent. So if you've ever had a hot pack put on your body, it may penetrate under the skin a centimeter and a half to warm up muscles and tissues in that area. The ultrasound unit can actually penetrate 2 to 3 times that depth. So depending on where in the body you need to get to as a deep heating agent to relax muscles, to increase blood flow to the area for healing, that's one of the tools of the trade. This is electric stimulation here, and I mentioned that previous with the spinal cord injury example on the treadmill, but these pads input electricity with the appropriate waveform under the skin for lots of different reasons. It could be pain modulation, pain inhibition. So if you're trying to inhibit pain, decrease pain, it could be used for that. It could be used to decrease swelling. It could be used to promote healing. You can actually make the muscles contract. So with the proper electrical stimulation, the muscles will twitch, they'll contract to fatigue. Maybe you want to fatigue a muscle that's in spasm, that's kind of guarded and tight. So lots of applications there from an electric stimulation standpoint. And then similar to the dog picture on the previous slide, you might say, well, this picture's out of place too. This is like gaming units. This is, using, a Wii Fit board. This is using Xbox Connect, things of that nature. Well, how fun is this? That there's good research that shows that through gaming systems, which these images show, you could promote strength of muscles. You can promote and minimize balance and fall risk. So, this is a bit outdated, but if you can envision kind of the Wii system or Wii bowling or any gaming system that allows you to play tennis remotely, electronically, to bowl, something like that, you could use those gaming systems to challenge somebody's balance. Obviously, as a physical therapist, you'd be standing beside them to protect them from a fall, but you're enhancing muscle strength and reflexes and things of that nature to promote or minimize balance and fall risk for individuals, which is very detrimental, by the way. An elderly individual that falls and fractures a hip, sadly, has a high morbidity rate within a year's time post-operatively. So if we can minimize those balance and falls risks, we certainly should do everything we can in our power to do that. All right, so before I get into this slide, so those were just some examples of kind of settings, like where do we work as physical therapists, who do we work with, what kind of tools do we have at our disposal. Here, and you can just read what's on this slide as I speak to some of the highlights. The American Physical Therapy Association is a large professional governing body of physical therapy in America. So your homework, if you're interested to learn more about PT, I would encourage you to go to apta.org. So APTA, again, is the American Physical Therapy Association. It's .org. On their website, there is a plethora of information. I can't tell you the exact link within their website, but it's something of the fact of, find careers or something of that nature. You'll find it. And within there, you can learn about different physical therapy programs. You can learn more about the profession. You can watch videos, so you can really expand your knowledge of the profession beyond what you're getting out of this. So physical therapy is at the doctoral level. So, in my introduction by Mrs. Liu, you heard that I hold a DPT degree, Doctor of Physical Therapy. You too would have that. So all programs in the country, of which currently there's 259 programs in the country that offer physical therapy, they're all at the doctoral level. This is a clinical doctorate, okay? It's not an academic doctorate. So my PhD or somebody's EDD or something of that nature, those are academic doctorates. A clinical doctorate really is your terminal degree in the profession of physical therapy. You need no other degree. It is the final degree in that profession. It is on par with a DC, which is a doctor of chiropractic, a PharmD, doctor of pharmacy, and so forth. So you've learned kind of the pinnacle from a degree perspective, what you need to for that profession, in this case, PT. You certainly can, should, and would go on for continuing education. So every state in the union requires some number of hours to maintain your license. Once you graduate from a physical therapy program, before you can treat patients, you need to pass a national licensure exam. That licensure exam is, I joke with our students that it's just a small little quiz. It's actually a 250 question computer-based exam that's set up for 5 hours. So it's a big exam, it's a long exam, and it covers the entire knowledge of a PT program's curriculum. Once you're licensed with your DPT degree, again, you're set up to then treat patients. Every 3 years, you have to renew your license, and each state requires a certain number of continuing education credits to maintain that licensure. New York State, by the way, happens to be 36 hours of continuing education credit every 3 years. Each state's a little different. Our profession has come a long way. My first degree in physical therapy in 1995 was a bachelor's degree. So PT used to be just a 4-year bachelor's degree. It then moved to an entry-level master's 5-year degree. And now the DPT for most programs in the country are 6 years. There are some 7s, but most are 6. You can see here on this slide, I talk about autonomous practice and direct access. Our profession has really expanded the needs of its education beyond the bachelor's level to the doctoral level for those reasons. We do have an autonomous practice. We do have direct access, meaning that you as a consumer of physical therapy services could go to a physical therapist without a referral from a physician, without a referral from your pediatrician, your family physician, to be examined and treated for physical therapy, by physical therapy. That's the direct access piece. That's the autonomous practice. You can see, hopefully, that there need to be an expansion of our education to allow that to happen. So here's a quick example. You could have a patient come through your door in an orthopedic setting that has back pain, say low back pain. They've yet to see anybody. You're the first person to see them. They have not had imaging done, so they haven't had x-rays, they haven't had an MRI, they haven't been examined by a physician, they haven't had blood work, no lab work, they've had nothing, and you're the first person to see them. Well, through your examination, you might identify something that you are trained to treat, something that is rather benign. Benign meaning, could it be a disc herniation? Could it be a muscle strain? something that we are quite capable of treating as physical therapists? Or could it be something more sinister? Could it be something that is more life-threatening? Point being, could it be a spinal tumor? Could this person have cancer that's causing referred pain to the back? That's pretty scary, right? So note that as physical therapists, we are not trained to treat the cancer. However, we need to identify those hidden findings, which are referred to as occult findings, and then refer the patient out, refer them to the appropriate individual, in this case, family physician, and or an oncologist. So that's kind of the two different spectrums of PT, an example of why we need an expanded educational sojourn through our PT programs, because literally patients' lives are in the balance. I mean, you literally could save somebody's life as a physical therapist, okay, by sending them out, by referring them out to somebody that would treat them for those more sinister findings. At the bottom of this slide, I point out in yellow here four key areas. So as physical therapists, we treat these 4 body systems. Now, again, I referred a few times now to the entry level. So physical therapy programs, the 259 number I mentioned, 259 programs in the country, these are referred to as entry level programs. It doesn't matter which school you go to for your PT program of choice, they have to prepare you for entry level practice. They all prepare you for success on that National Physical Therapy exam. Again, that's that 250 question, 5-hour quiz. So how they go about doing it could be unique to their program. What courses do they deliver? How do they deliver them? What's their curricular design and plan? That certainly can be unique and is unique for those programs. But these 4 body systems down below are what we treat and where we treat. So we examine the musculoskeletal system. Again, that's orthopedic. We address neuromuscular. Neuromuscular, an example there, you've heard a few of these already, but to put it into context, pediatric wise, it could be kids that have Down syndrome, cerebral palsy, developmental delay. As we grow and develop, maybe it's multiple sclerosis, MS. As we grow beyond that, maybe somebody has suffered a stroke. Maybe somebody develops Parkinson's disease. Okay, so neuromuscular wise, those are some examples, not exhaustive, but some examples in that arena. Cardiopulmonary. What do we do in cardiopulmonary? Well, we address heart and lungs, right? That's cardiopulmonary. So we're all about it, once again, restoring function for individuals that might have just had open heart surgery. Okay, you can imagine the recovery of that. Perhaps some of you listening to this have had a grandparent that has had open heart surgery. Think about the recovery that's required there. They might have a pulmonary dysfunction like chronic obstructive pulmonary disease, emphysema. Oh, and guess what? Sadly, we can talk about COVID, right, over the last year and a half. And so we treat patients, with COVID, post-COVID, to restore function because of the impact that has on their endurance level with the impact and affliction of the lungs. And then the integument. So integumentary is skin. So you might pause and say, well, the skin, what do physical therapists do for the skin? Are we dermatologists? And no, we're not. But physical therapists treat open wounds, okay? Think about that, open wounds. We do it at entry level. As you're listening to this, you might say, open wounds. Wow, an infected wound, that doesn't sound pleasing to me, or for some of you, that might sound very enticing and exciting. The beauty of our profession is once you're licensed, once you pass that licensure exam, what you decide to do with your career thereafter is up to you. You could be a generalist and you can do a little bit of everything I'm talking about here. You could specialize. You could say, I want to really focus in on my passion on sports medicine, my passion in pediatrics. I want to work in a school system. I want to do wound care, or I never want to do that again after school. It's totally up to you. But you all have to be competent and identify pathologies within those areas because of the autonomous practice, because of the direct access. You could always refer them out to somewhere else, but you have to be somewhat knowledgeable in that area. Just an example of the integument piece and how rewarding this could be. So here's the setup. You've got a patient that, let's say, is a brittle diabetic. So with diabetes, there's, they have poor sugar as a challenge with, sugar assimilation in the body. And due to that, they often have poor healing properties. Oh, and guess what? This person is also a smoker and they have poor dietary habits. They don't exercise. All of those contribute to poor healing properties, right? So this poor individual, they have an open infected diabetic ulcer on their foot. And it's so bad that they're actually scheduled for an amputation of their limb. You saw those pictures earlier with the prostheses. They're scheduled for an amputation of a limb, a few weeks from now. But before they go that route, because they want to preserve the limb, they send them to you as a physical therapist to see what you can do. You as a physical therapist would learn how to do sharp debridement. So we as physical therapists learn how to use a scalpel, to use forceps, to use scissors, to clean out what's referred to as debriding, debride this infected wound. Apply dressings, apply the appropriate dressings to promote healing, and use modalities. That electric stimulation I showed you earlier with the proper waveform has shown to be very effective in many instances at drawing our cells of our body to that area to promote healing and closure. And guess what? How rewarding is this? Now, sadly, not always is this the case, but there's many a documented case of this where you could potentially close that wound, heal it, clean out the infection, promote closure of the wound through your knowledge, through your treatment as a physical therapist, and prevent an amputation. How phenomenal is that? Prevent an amputation of a limb for somebody. So extremely rewarding in that area. You can see down here the career options where we can work as physical therapists are listed here. On this slide, I point out, again, I mentioned that I use a lot of my slides here for our open house at Daemen College. So I don't expect you to recognize names of our faculty, and that's not why it's here. I want to point out credentials. So you can see the PT here. So that shows that our faculty are licensed as physical therapists. You can see that many of them, most of them have the DPT degree, the Doctor of Physical Therapy. Then after that comes additional credentials, board certifications, if you have an interest. It's not a requirement. So Dr. Boggs at the top here, certified vestibular rehabilitation specialist. So our vestibular system is about our balance system. If you've developed ringing in the ears and things like that, that affects your balance, that's your vestibular. So PTs address that. Dr. Bogalski here with the OCS. I have an OCS. That's the orthopedic certified clinical specialist. So these OCSs, PCSs, which is pediatric, NCS, neurologic, these are advanced board certifications in an area of interest of specialty. Okay, so it's a clinical specialty. Dr. Brogan has a wound care specialty. Another one to point out, Dr. Policella, certified manual physical therapist, so additional hands-on skills that you learn and we do a lot as physical therapists with our hands to promote, again, function and well-being of our patients. And Dr. Scheid at the bottom, one additional example, certified strength and conditioning specialist. Physical therapists are really known to be exercise specialists, so she has that advanced credential. So there's things that you can go on to advance your career should you choose to specialize in different areas. All right, so if you're interested in physical therapy, what should you be doing in high school? What are admission requirements to PT programs? I'm showing you ours, and then I will touch on what others may be. So to be accepted into our program at Daemen, we would look to see that you have a minimum cumulative high school average of 88%. If you've taken the SATs, and I know that many probably didn't because of COVID, and maybe you're not there yet and you will, but if the program requires SATs, for ours it's a 1080, ACT 22. Now, physical therapy is very science-based. It's a health profession, not unlike medical school and things of that nature. It's a science-based profession. So we look to see that our high school students that come to us that had a minimum of 3 years of high school science, including chem, and 3 years of science of math, including trigonometry or the equivalent thereof. Okay. Now, other schools are similar, right? But everybody has different requirements. So I've seen 90%, 92. I've seen as high as 94% high school average minimum. I've seen SATs up to 1,200, depending on the school. But the minimum science and minimum math is pretty typical. I can't say it for all of those 259, but pretty typical at most schools as a requirement. Our program happens to be what we refer to as a 3+3. We have a 6-year program, as I mentioned earlier. It's a 3+3. The first 3 years are pre-professional years. They're our foundational years. They're preparing you for success within the professional phase of the program, which is the last 3 years. Our program accepts transfer students. So a student can go to another institution, be it a 4-year school, be it a 2-year school, take a few courses, take a bunch of courses, earn credit within them, decide they want to transfer to our program. That's where this transfer comes in. They fall into that pre-professional phase, those first 3 years, finish up what they have to then move into the last 3 years, which are the hands-on professional phase. Direct entry, by definition, I know this was a question that was posed by some. Direct entry refers to as post-baccalaureate. So this would be an individual that's already earned a bachelor's degree. They've met the prerequisites. And on the next slide, you'll see what those major science prerequisites are. They've met those. They're not transferring in and finishing things up. They've met those. So they are direct entry, post-baccalaureate. They would then move directly into, hence the term direct entry, directly into the hands-on portion of our program, which is the last 3 years. So they would complete 3 years. Let's assume it took them 4 years to earn their bachelor's degree, which is possible, but it's not unheard of for it to be longer. It could be 5 years. But let's say it was 4. They're really completing their completion of their DPT degree in a total of 7, right? It took them 4 years to get their bachelor's. Now they come in direct entry, another 3 years. That's a total of 7 to get that. If you go into a program like ours, and there's others like ours that are a 3+3, you earn your bachelor's degree within that program. So at the end of the 4th year of the 6, you earn that bachelor's degree and then finish the last couple of years to get the DPT. So you get 2 degrees. You get a bachelor's degree, and that could vary. It could be a natural science degree. It could be an exercise science degree, depending on the program. So you get that degree plus the DPT in a total of 6, okay? So you'd want to decide of interest, if you're interested in PT, that 3+3 program may save you time in completion of those degrees. But if you're unsure, there's nothing wrong with getting the bachelor's and then moving into a direct entry route. Once you're in the professional phase of the program, again, for us, it's those last 3 years, these would be standards, to get you there. And so while you're, let me back up and rephrase. While you're in a pre-professional program, I just misspoke. While you're in a pre-professional program, what do you have to accomplish to be successful to move into the professional phase? Every program is a little bit different. Ours happens to be a 2.8 minimum GPA. Most schools use a 4.0 scale. So a 3.0 is a B, right? So when you're talking 2.8 or better overall GPA, that would be, roughly B's on average. It's an occasional deficiency below that. So you're a 2.8. I've seen schools at a 3.0. I've seen schools at a 3.2. So our entry standards into the professional phase are a little bit lower than some or even most schools. So keep that in mind. 3.0, 3.2 is not unheard of. Then, as I mentioned previous, our profession is so science-based. The second bullet here refers to no grade less than a C and a minimum of a 2.8 in those prerequisite science courses, which again are forthcoming on the next slide. So we want to see success in the sciences because that has actually been shown nationally across all these schools to be the strongest predictor of success for students in professional program is their science GPA, okay? Some form of clinical exposure hours are typical for programs. The PT school wants to make sure that you're making an informed decision. They want you to do some hours of volunteer or shadowing to get your feet wet. I would say to all of you, now would be a good time if you're interested in PT to learn more about it. Call up, the hospital, call up a nursing home, call up a private practice and let them know I'm interested in PT. Can I come and do some shadowing hours, learn more about it? That's what I did. That's what I did to learn more about PT, and it really stuck with me, that experience. Very often there's character references needed, things of that nature. So that's listed here. That's not to be unexpected. And then here's now the professional phase academic standards. For us, once you're in those last 3 years, we raise the bar a little bit. So the 2.8 now becomes a 3.0. So we look for a minimum GPA of a 3.0. Again, some schools may be higher. You might need to keep a 3.2, a 3.3, whatever it is. Typically, schools would look to see, is there a correlation between success within their program and success on that national physical therapy exam, right? Because that's really, I don't want to just call it the finish line because there's more to it than that. But for you to be licensed to treat patients, you have to pass that, right? And so to pass that exam, that's really a benchmark that we strive for in PT programs. So any predictor variable we can identify that promotes success on that NPTE, National Physical Therapy Exam, we certainly look to do that. So for us, that 3.0 has been shown to be a pretty good, predictor for success on that exam. And then some schools like ours, do a holistic review process. So, I'd like to think all programs would say what I'm about to say, that you're a person first, you're an individual first. We don't just look at you as a number. We don't look to see, oh, this person has an 89 average, welcome to our program. Let's look at the whole application. Let's look at the whole process. So Daemen College happens to be test optional. We would look at senior year, the courses you've taken, contextual factors, scholarship, for scholarships, activities, essays. Most schools look at the full package of an application. All right. These are practice settings. So on that last slide, I put in there shadowing hours, volunteer hours. I've already touched on some of these, but I'll just pull these up. So again, where could you do volunteer hours at? And probably more importantly, where can you work as a physical therapist once you successfully graduate from an accredited program, as well as pass that licensure exam? You can see there's lots of places we can work in as physical therapists. Lots of great opportunities. All right, so these are those major science courses. And before I go through those, I'll just point out here at the top, core curriculum. So depending on what school you go to for PT, like Daemen College, which has a liberal arts background to it, that's our core, that's our general education. So you would take, a culmination of credits within the core, 30 credits, 45, whatever it is, because you're going to progress to earn a bachelor's degree. And then on top of that are these major science courses, and then obviously your DPT courses. The major science courses for most schools, again, I can't claim to speak for the 259 in the country, but most are very similar, that when you're in an entry-level program, in your first 3-4 years, these are the courses that you're required to take. 8 credits of biology, 8 credits of chem, 8 credits of physics. And then the anatomy and physiology, that could be anatomy and physiology 1 and anatomy and physiology 2, totaling 8 credits. Or for us, we happen to have a separate 4-credit anatomy course and a separate 4-credit physiology. But in essence, it's 8 credits of A and P as it's referred to. We have a bioorganic chemistry requirement for lecture, not lab, but this is an example of maybe an outlier. Some programs replace this with an introductory statistics course, so thinking about stats. We think this is a good course for critical thinking and problem solving. That's why we include it. Minimum level of composition, so Comp 101, which is going to be taken at really any school. We have an advanced composition requirement. Our math requirement minimum is pre-calculus, and that's because our physics requirement is a pre-calculus based physics. Depending on what school you attend, it could be calculus because the physics, might be a calculus based physics. So you'd have to look at the school and see what the need is there. And then introduction to psychology, a lot of what we do as physical therapists is psychology related as we work with patients. So a minimum of at least 1 psychology course, intro to psych, would be required. For our program, and I can't speak for all, but for our program, in those first 3 years, those first 3 pre-professional years, students are taking PT courses. They're just not the hands-on PT courses. So we have a 1-credit freshman seminar, in PT. You're learning about the history of physical therapy, our practice act, what we can do, who we can do it with as PTs. Our sophomore seminar gets into medical terminology and therapeutic communication. How do we interact with patients? And then principles of teaching and learning for us is a junior level course, a third year course, where as physical therapists, we teach every day. Doesn't mean you have to teach behind, a podium as an educator, a teacher, but we teach every day. We teach our patients, we teach family members, we teach other healthcare professionals. So to learn how to teach and how people learn is an important element of being a physical therapist. So we have these courses, and a lot of schools have something very similar. So then we move to the professional phase. And so for us, these are our 3 years. Now, I mentioned again, what's in yellow there, these are the body systems that we treat as physical therapists. And so our program sets a foundation in that first year of the professional phase, which again is musculoskeletal. Our second year is that neuromuscular year, and you can see some other some other courses that are important within that year. And then the third year of our program is the cardiopulmonary integument, some other courses. Now, many schools do a little bit of musculoskeletal, neuromuscular, cardiopulmonary integument in each year. Okay, so there's programs like that. So instead of a 5-credit musculoskeletal rehabilitation course, which we have in that first year of the professional phase in the fall and the spring semester, 5 credits in each, you might have 2 credits, you might have 3 credits. But then that expands into the second year and the third year if you follow. So you got to just look at different programs, see where you think is a good fit for you, where you feel you would be most successful as a physical therapist at that school. For us, with our program, which has been around since 1974, that we found this to be an successful practice of building a foundation of orthopedics, musculoskeletal, and then moving on as shown. I do want to highlight the internship piece here. So there is a requirement by the accrediting body of physical therapists that PT programs have no less than 30 weeks of full-time clinical experience for our students. It's referred to as clinical internships. We happen to have 36 weeks. The minimum, again, is 30. I think the average in the country is 32. What that entails is you would have, in our case, these are 36 weeks and there's 4 of them. So you would have 4 9-week internships. And the 9-week internships, those are full-time internships, full-time experiences. So on average, 40 hours a week for 9 weeks, you're working side by side with a licensed physical therapist, applying that which you've learned in the classroom and laboratory, okay? I've seen programs in the country that have 12-week internships. I've seen programs that have had as few as 3 or 4 weeks. So they all vary, but nobody can have less than 30 when it's all totaled up. What will often happen is you'll do an internship after you've completed some knowledge of academics. That would make sense, right? So for us, this first internship is in the summer between year 1 and 2 of the professional phase. And we purposely put you in an orthopedic setting, right? Wouldn't that make sense? You just had a whole year of musculoskeletal related content delivered to you in lecture and laboratory. You've worked with your hopefully healthy peers in lab practicing techniques. Now is a good time to go out for 9 weeks full time with a licensed PT and work with real patients. So that's kind of a similar model to most schools that would have that opportunity. The second internship for us is in the summer between years 2 and 3. If you're following the theme here, this is in a neuromuscular setting, right? So you just did a whole year of neuromuscular. Your internship could be in a school-based setting. It could be in a nursing home, subacute rehab, hospital setting, somewhere where you can work with patients with neuromuscular related disorders. And then down here, notice it says clinical internships, plural. Our last 2 internships for our program are in the final semester of our program. So in the spring semester of your 3rd year, you're not on campus at all. You're doing 2 9-week internships back to back. It might be in an acute care setting in a hospital. You might be able to pick one of your choosing. So let's say you really love pediatrics and you want to do a second one in that area, there's an opportunity to do that. So there's some uniqueness here for each school and how they do it, but hopefully you get a sense of the requirement of full-time experiences. This is just a snapshot view of the first year of our professional phase. And, the first semester, fall semester, you can see you're taking a functional anatomy course, you're taking a movement science course, which applies anatomy, that's the kinesiology, biomechanics. You're learning about physiology of exercise, excuse me. Clinical medicine is a course where you learn about pathophysiology. Our curriculum happens to have these clinical exposure courses, and it happens to be in each of our semesters. So above and beyond those full-time clinical internship experiences, you're getting an additional hands-on opportunity with patients. So the way this clinical exposure course works is every other week for 2 hours, you're actually interacting with patients. You're in the clinic, small groups of students, 3-4 students, working with a licensed PT and interacting with patients. So those are interprofessional related experiences. Those are not full-time experiences, but kind of part-time experiences. And most programs have something like that. The numbers that are listed here are the number of credits that you're taking for courses. So it's not uncommon in PT programs to be taking 17, 18, upwards of 19, 20 credits in a given semester to earn your DPT degree. I always tell our students, and perhaps other programs do the same, that DPT programs are a full-time job. I mean, there's a lot of business there. Again, it's a doctoring profession. There's a lot to learn. So, it's a full-time job with overtime for 3 years, but the payoff is huge. It's just a wonderful, wonderful profession to be able to have the privilege to work with patients on a daily basis to enhance, restore, and promote function. All right, I'm going to skip that slide and move into this one here. So from a job outlook perspective, here's some information for you. And you can see the reference at the bottom, the source. So I would encourage you to go to that, if you're interested in PT or any profession for that matter. So the Bureau of Labor Statistics Occupational Handbook, you can learn about a lot about all professions. But if you go there for PT, this is what you'll find currently. That over the next decade, from 19 to 29, there's an expected growth of 18%. So that is a growing profession. And you can see the bulleted items here as to some of the reasons why. That our first wave of baby boomers just a few years ago turned 60. We're an aging population, but we're an active aging population. We have increased survival rate, life expectancy, things of that nature. So it is a profession where jobs are still plentiful. We have to report, all PT programs have to report job placement, job security, post-graduation of students. And our program, which I think most would say the same, has 100% job placement. So you can and will find a job with this growth in PT. Jobs are out there. When you think about wages and salaries, this again comes from the Bureau of Labor Statistics. So the median annual wage of PTs is just shy of 90,000 as of May of 19, and you can see the low 10%, high 10%, and so forth. I certainly can't speak to every state in the union or region and so forth, but on average, an entry-level starting salary, because note again, this is the median, might be high 50s to mid 60s, somewhere in that area, maybe a bit higher. So to give you a sense of what am I going to come out with as a starting salary, but again, that's regional depend. If you move south, if you move to the Midwest, I know that those starting salaries are a bit higher. If you're a bit more saturated in your area where you live with PTs, it might be a little bit lower. So it just depends, but you can certainly see that you can make certainly a decent living as being a physical therapist. And the median wage of all occupations from the Bureau of Labor Statistics is just short of 40,000. So that's all occupations combined. And you can see the advancement of that for physical therapists. I'll just highlight a few images here. These are our facilities to give you a sense of what a PT department might look like. Each program is obviously going to be different. This is Daemen College. This is a building at Daemen that houses a number of our labs. We have a pretty good footprint in this building. This is one of our labs. This is our neuromuscular lab. This is our anatomy lab. So PT programs may do human cadaver dissection anatomy at the 500 level of coursework, which we do. Many programs with the advancement of technology have moved to different apps. Visible Body is a great source if you're interested in looking at some of these 3D apps you can purchase. Visible Body, 3D for medical. Some programs use plasterized models. Not all programs use human dissection, but we have. And we've celebrated that for many years. We think it's a strong part of our curriculum. We have an academic and wellness center at the college, and this opened up in 2015. This is one of our lecture halls that's dedicated to physical therapy. Point out something here on these images. Depending on the school, again, this is unique for us, but others may have it. There could be technology available to augment your learning. There's a camera here on the wall that's a 30 times optical zoom camera that can zoom in on an instructor doing a demonstration. This happens to be zoomed in on a skeleton model in the middle of the room, and then that projects up on a screen here, as you can see. So students get to stay seated at the comfort of their seat. They can see what's being demonstrated, don't have to stand up in front of others and such and miss out because the tallest person's in the front, as it always happens. A typical, physical therapy laboratory may look something like this. These are treatment tables or examination tables. So when you're practicing hands-on techniques, you'd have some setting like this, especially for orthopedic, musculoskeletal. This is our laboratory where we do exercise physiology and our modalities. So you can see treadmills here. Here's a traction table over here. We've got computer systems in the back to do different testing, stress testing of patients. This is a freezer for ice pack usage. There's what's referred to as a hydroculator back here for hot packs. So again, we use lots of different therapeutic modalities to augment care for our patients. You would learn that in a laboratory like this at whatever school you're at. Many schools have a research laboratory. This is ours that we just recently opened this past year. So a lot of PT programs have a capstone research project that you have to do within it. So you would actually typically collect data on patients. You'll analyze that data. You'll put together, a presentation. It could be a manuscript, a paper, whatever it is. So, you would expect to do some type of research, in physical therapy through a program, I would imagine. And here's some examples of that. Students collecting data for research, within a program, hamstring length, flexibility. Here's our orthopedic lab looking at foot and ankle range of motion and stress testing of ligaments, things of that nature. Here's an example of a lab where you might, when you're learning about muscles, maybe stringing up muscles on a skeleton to see the three-dimensional nature of them, understanding what muscles action are and function are. Here's an example of a posture analysis lab. This is Dr. Bogalski here. There's a plumb line string hanging here where we use that for like the line of gravity to look at posture, trying to promote good posture in patients. Here's an example of, as a student in a physical therapy program, if you do research, you have an opportunity to present that research at a professional conference. So the combined sections meeting of the APTA, this is a little dated now, but you can see here in Las Vegas, this is one of our students who actually presented his research at a national conference. So you have an opportunity to do something like that. Research posters can be presented. So lots of opportunities. If you like research, you like that interest, you can do a lot of good PT research and publish. You can write textbooks. You could present your research at different conferences, which is terrific. Let's skip through this real quick. And then, getting toward the end here of our time, but when you look at where physical therapy education has gone, we've really moved to what I refer to as the medical model. So, if you think about medical school, if you want to become a physician, you would go to medical school, right? 4 years. Then you do a residency. Then you may do a fellowship. And you might advance your education thereafter. Well, guess what? PT has models like that now. Now, it's not required. You could graduate from an accredited program, as I mentioned, pass that licensure exam, and never go back to school thereafter if you don't wish to. But If you want to go on to a residency program, here are just some examples. There happens to be some students in our program that have moved on to a neurological residency, orthopedic residency, cardiovascular, pulmonary. What these residencies refer to, women's health is another area that PTs address. What you're doing here is you're working, residency could be a year, it could be 18 months. It's a time spent working side by side on a daily basis, treating patients, not just like an internship, but daily for a year to 18 months with true clinical specialists, the OCSs, the PCSs, these clinical specialists where you're getting and springboarding your career and advancing your career through a residency opportunity model, if that's of interest to you. Again, not a requirement, but if it's of interest. All right, so that actually comes well to our time here. So we just have a few minutes left. This is my contact information. Oops, it's not coming up. There it is. Sorry about that. Do it this way. Here's my contact information, that if there are any questions that anybody has.
Yes, Dr. Ford, I have two questions.
Certainly.
Okay. First of all, does the Daemen take the AP credits from the high school?
Yeah, great question. Yeah, and I would say yes. And now it depends on the performance of that AP course, right? And again, I can't speak to all schools, but AP typically has a ranking of 5. So if it's a major science course, let's say you want to bring in biology 1, or you want to bring in pre-calculus, those are important courses for foundation for success to move into a professional program. I can't speak for all schools, but very often it might be a minimum of a 4 on the AP exam to have that type of course come in. Whereas, maybe if you took a psychology AP course or a government or something like that, world history, maybe a school would accept a 3, on the AP. So it all depends on the school, but absolutely, I would say that Daemen certainly, and I like to think most schools would be open to an opportunity to transfer in AP credit from high school.
Okay, another parents have the question. They also heard about so-called 3+3 that you just explained, and the direct entry. Their question would be a much less spot available for the direct entry because most of the students come up from the 3+3.
Yeah, another good question. So our program, and again, I'm trying not to sell Daemen's program, but this is what I know, right? So our program, if you commit to Daemen College as a physical therapy major, as a freshman, you have a guaranteed seat waiting for you in the professional phase. There's really no reapplication opportunity. Now there's paperwork that has to be done. There's academic standards along the way that you have to meet, right? It's not just a free ride. But when you meet those academic standards, you don't compete against anybody but yourself. You do not have to reapply. It's seamless transition from the first 3 years into the last 3 years. That's the beauty of that guaranteed seat. Again, I can't speak to all schools, but schools that are a 3+3 often offer that opportunity. You commit early, there's no reapplication, you move through. Now, a direct entry student, more to the question, direct entry again is post-baccalaureate. A lot of schools that are 3+3 have an opportunity for direct entry students to join the program, but it's on space availability. So, our program happens to be a target number of 70 students per cohort. So we strive for 70 students in each professional phase class. If we bring in, let's say we bring in 75 freshmen, and by the time we get to year 4, which starts the first year of the professional phase, we've got 70 students of the 75 that persisted. Well, guess what? That's our professional phase class. That would be a year that we would not have, even though they've applied, we would not be able to accept any direct entry students. So they would lose out on a seat because it wasn't available. We've had other years where we've been in the 50s. So we haven't had as many persist for lots of reasons. They have a change of heart, they go on to another profession, they leave the institution, whatever. We've been in the 50s, so then we could have 20-ish, direct entries, add to that class. But that's always based on space availability. It's never a guarantee. So I guess I would encourage you, from my position, to look at schools that have a guaranteed opportunity, a guaranteed seat in a 3+3 if your heart is set on PT, because then that burden is off your shoulders. Am I going to get in? Am I going to have a seat? What am I going to do? It'll be there for you, because otherwise it's somewhat of a gamble. Is there going to be a space for me?
Okay, the last question from the parents would be the internship. I know the Daemen is located in New York State. How about if student wants to intern in the other state, like say in Texas, in Florida, will the Daemen would help to find the student to internship in the different states?
Yes, yeah, another great question. So because we've been doing this since 1974, we've made lots of great contacts. So we currently have over 550 contracts around the country. That doesn't mean every internship that comes up, you can choose from 550. So there could be a year where a facility doesn't take a student, but we've got lots of contracts. And in fact, because our program's been around so long, as has many others, we have contracts and clinical internship sites in every state in the union. So to your example, let's say you've got family members, you live in New York, but you got family in Texas or Florida, North Carolina, California, wherever. And you're thinking, well, here's a nice opportunity. I can go and live with my grandparents, my aunt and uncle for 9 weeks in the summer and do my internship in San Diego. You may have an opportunity to do that. So there are opportunities to do them outside of the state, absolutely. And you don't have to find them. The internships are provided to you. You get a list of internship sites that are available, and then there's a selection process as to where you would identify where you want to go. How we got to 550 plus really has been with the help of the students. So let's just say that some student that's listening to this really wants to do an internship in region X, in state X, city Y, whatever. And we currently don't have a contract with that facility yet because we just don't know about it. There are opportunities for students to work with our director of clinical education to set up a contract at that site. Well, the beauty there is it's a win-win. Now, you as a student, guess what? You're the first to go there. You have an opportunity to do your internship there because that's where you wanted to go, and you're the first. But now we've established a contract for future students to have an opportunity to go to for years to come. So yes, there are opportunities to do them in every state in the union. And at Daemen, we actually have an international opportunity. So for the last two internships, we have a contract with a very large health system in Italy. So internationally, students can go for the last two internships to Italy and do an internship there. Other programs in the country have other international opportunities if that's of interest to you as well.
Okay, now we're going to wrap up today's program. We really thank you so much, Dr. Ford. It has been such an informative workshop. I have learned a lot. Now I know more about the program. I believe the students who attended would learn the same thing like I'm learning now and bring back the information to their peers. So thank you so much. And